We're going to move on to panel one, and I will hand it off to my colleague, Dr. Nadra Tyus.
Thank you, Shalonda, and thank you, Erin, for that great presentation. I am very excited to introduce our speakers for our first panel on the school health environment, research successes, gaps, and opportunities. Our first speaker is Sharon Tennyson, who is Professor of Public Health Policy and Economics at the Jeb E. Brooks School of Public Policy at Cornell University. Then we will have Erin Hager, who is an Associate Professor at the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. Then our third speaker for this panel is Katrina Debnam, who is an Associate Professor at the School of Education and Human Development and School of Nursing at the University of Virginia. Then we're very delighted that our discussant for this panel will be Kathleen Eder, who's the former director of the Division of Adolescent and School Health at the Centers for Disease Control and Prevention. So Sharon, are you ready?
I believe so. Can you hear me?
Yes, we can hear. We don't see you, but we can hear you.
Oh, you can't see me?
Can't see you.
Oh. Well, I apologize. I'm having some technical difficulties. I think perhaps in the interest of time, I should not try to deal with those now, and I will move on with my presentation.
Thank you.
This way you can all just imagine what I look like, and hopefully I will figure this out as other speakers are talking and be more present when we get to the Q&A. So thank you very much for having me to speak with you today. I'm going to use my time to talk about school-based health centers, particularly school-based health centers in rural schools, which is a topic that I'm researching currently. Could you do the next slide, please? This is a nice fit, I think, with the discussion in the keynote speech about institutional structure and service delivery models, because school-based health centers, which are healthcare clinics that operate on or near school grounds and are targeted toward low-income school districts trying to address healthcare needs of children who are medically underserved, are nurse-led practice models with multidisciplinary providers, physician support, and other clinical support. And so this is a particular institutional structure or service delivery model that highlights and emphasizes the role of nurses and nurse practitioners in the school environment. School-based health centers were first started in a few urban schools in the 1960s and have grown tremendously over time, so that now there are nearly 4,000 school-based health centers in nearly every state in this country, and 36% of school-based health centers are located in rural schools. Next slide, please. So important benefit of school-based health centers is that they increase access to health care, particularly when we recognize the multifaceted nature of access. The slide I'm showing here is adapted from a Rural Policy Research Institute white paper in 2014 and emphasizes that access requires more than just setting up a practice and opening the doors. To truly provide patient access to health care, providers need to understand the characteristics of the population served, and especially those at risk for inadequate care. Need to make sure that barriers, including geographic distance, transportation, internet connections, for example, are minimized. Need to provide compassionate and culturally aware care and a good fit so that trust can be built between providers and patients, and need to assure that patients have access or that access is not limited to ability to pay. School-based health centers hit all of these aspects. And from my perspective, this is really the secret sauce of school-based health provision, that we can provide access, thinking about it in all of these various dimensions. If we move to the next slide, please. This slide, which I know is quite busy, and we're not going to go through the details of it, but if you have the opportunity to study it, I think it is informative. This is adapted from a 2016 Community Guide Systemic Review of School-Based Health Centers, and it shows the multiple pathways by which SBHCs can improve health outcomes. There are two key takeaways that I want to share from this slide. The first is that there are multiple pathways through which school-based health centers can improve health outcomes, including health education, trust, and creating an unusual source of care. The second point that I want to emphasize here is that there are also multiple measures of improved health outcomes that are relevant, including appropriate use of healthcare, reductions in risky health behavior, and improved academic performance. So if we look at the environment of school-based health and put the school-based health center into that framework, we see that we're able to address a lot of the issues that nurses are concerned about in the healthcare environment. The research literature on SBHCs that this 2016 article reviewed largely concludes that school-based health centers impact health outcomes via the pathways that are shown in this diagram. The literature shows that definitely school-based health centers increase utilization of regular preventive health care, they improve management of chronic conditions, and they increase access to behavioral health and dental health care. There's also some evidence, but less conclusive, and this could be areas for future research, that school-based health centers may reduce risky health behaviors and also help to keep kids in school. And we'll address that second one a little bit later. If we move to the next slide, please. So there are certainly gaps in the evidence base, and I've listed a few here that I think are important to think about. The first one that I've listed is the question about long-term impact. I think what we'd really like to understand are whether students who are served by school-based health centers during their K-12 years exhibit better health behaviors, more regular use of the healthcare system, and better health outcomes as adults. Right? Most of what we currently know about school-based health centers focuses on the immediate impact on students and student health. We also need to better understand the differences in effects and effectiveness of SBHCs across different health conditions, but also across different populations served. So as I mentioned, the main focus of the research I'm doing is how do school-based health centers in rural schools impact health, and does that differ from the way that school-based health centers in urban schools impact student health? A third thing that I think needs additional study is whether school-based health centers affect health behaviors and health outcomes beyond the school populations that they serve. Now, some school-based health centers serve non-student populations as well as students, but that's less of what I'm talking about. What I'm emphasizing is that even those SBHCs that only serve students who are enrolled in the schools may be expected to have community and family-wide impacts due to their placement in the schools, their integration into the school, and their partnership with the schools. And the final question is really one of synthesis. There is a large literature on the impacts of school-based health centers. Most of it is focusing on, given the nature of research, much of it is focusing on specific interventions, specific outcomes. What's really needed in this literature now is to try to synthesize what we know so that we can have a better understanding of what's the most effective and impactful way to provide school-based health. including the system of care, nature of collaborations, and how, if at all, does this differ across school and community environments. Could we go to the next slide, please? So with these questions in mind, I want to move on to talk a little bit more specifically about my research on SBHCs in rural schools. So our research project is a collaboration between a multidisciplinary team of social science researchers and public health researchers at Cornell University, and clinical researchers and school-based health center staff, Bassett Healthcare Network in New York State. For those of you who don't know Bassett, they're located in Cooperstown, New York, and maybe you know Cooperstown as the home of the Baseball Hall of Fame. Its second claim to fame is it is the headquarters for Bassett Healthcare Network. So Bassett is the predominant provider of healthcare in a 9-county region of upstate New York surrounding Cooperstown, and the only provider of school-based health in that region. In the 4 county areas that we're highlighting here, Bassett operates some school-based health centers. And what's nice from a research design perspective is that the communities and the schools are relatively homogeneous, but Bassett operates school-based health centers in only about half of the schools in the 4 counties of this state. So our research approach is to evaluate the impact of these school-based health centers by comparing outcomes and processes across school districts in this 4-county region that have a school-based health center and those that don't. If we could go to the next slide, please. So all of the Bassett SBHCs are full-service healthcare clinics that operate directly in a school. They provide preventive care, including well visits and immunizations. They provide care for chronic conditions and acute conditions, and they provide behavioral and dental health care. For specialist requirements and hospital visits, they refer out to other providers within the system. Another thing that's nice for our research project is that all of the school-based health centers that we're studying then operate under a single system of care. Bassett has a school-based health division, and so within the network, all of the school-based health centers are comparable. So we have a pretty nice way to compare a set of school districts that have school-based health centers and a set of districts that don't have school-based health centers. Now, we're not just doing this in the current time period. We have data over time, which we haven't fully taken advantage of yet, but this is a key part of our study. Bassett opened its first school-based health center in 1992, and actually relevant to the keynote speech this morning, the first school-based health center in Bassett was founded by a school nurse, who then came on to be the head clinical nurse of their entire school-based health center division, right? But it was Jane Hamilton, her idea that the school nursing environment needed to be expanded in the schools, and that's how Bassett got its first school-based health center in 1992. So we have a range of observations about school-based health, right? Some school-based health centers are mature and have been operating since the 1990s, but Bassett has continued to expand the network of school-based health centers as they've had the opportunity. So we also see some that are just opening, including one in 2020 and one in 2025. If we could have the next slide, please. So our research takes a multi-level approach using a social determinants of health perspective, right? So we apply our research lens to the individual level, the school and school district level, and then the greater community level. So we're interested in exploring the impact of school-based health access on children's healthcare utilization and health outcomes, right? We're also interested in exploring the impact of school-based health centers on cross-agency collaboration between social service agencies, government agencies, the school-based health center, to see if having a school-based health center in the school increases cross-agency collaboration. And then at the community level, we're hoping to bring these two questions together to try to measure the impact of having school-based health on community level outcomes, including health behaviors, health outcomes, and broader outcomes, including academic outcomes in the schools. Next slide, please. So we have very good measures of healthcare utilization and health outcomes because we have access to data on all patient encounters with the Bassett Healthcare Network over more than a decade. So this is how we're going to examine healthcare utilization, management of chronic conditions, health outcomes. And the chart on the right I've included to emphasize the importance of SBHCs in this region. So this chart is just looking at the 4-county region, and it's combining years 2011 through 2017. And what it's showing is that in these schools, about half of which have school-based health centers and half don't, just over half of the school-age patients in the Bassett network attend a school with a school-based health center. But it also shows that among students who have access to a school-based health center, 76% utilize the SBHC, and 52% of them exclusively utilize the SBHC for their primary care needs. Another 24% of students saw primary care providers in the SBHC and in other healthcare clinics, right? But we were particularly surprised to see the 52% that had this strong link with the school-based health center. Next slide, please. This slide shows just in descriptive statistic, impact of impact on school age use of primary healthcare services among school-based health versus non-school-based health, right? And so we see some expected patterns here. There are additional deeper differences that we won't have time to go into today, but I'm happy to provide papers or references to anybody who's interested in more information about the research. If we go to the next slide, please. As I mentioned, we can also follow schools and children over time. So this is a slide that's looking at the impact on primary care visits of opening a school-based health center in the Richfield Springs in the Richfield Springs School District. What this slide is doing is comparing Richfield Springs to all of the studied school districts who don't have school-based health before time zero, which is when they opened their school-based health center. And then looking at the relative increase in primary care visits after the school-based health center was opened in Richfield Springs, and we see a dramatic increase, right? And this is also then reflective of, in our summary statistics, of the large number of students who only utilize school-based health centers when they're available. If we could advance the slide, please. And let's advance now, because I think we're going to be short on time. So one more. I also, oh, sorry, could we go back to attendance? Thank you. We also have information on school attendance. This is not linked to our health records data. This is data that we got from school superintendents. But we do have a way to compare schools that have school-based health centers and schools that don't have school-based health centers. And what we see here is that there are positive effects of school-based health centers on school attendance. It's not a magic bullet for chronic absenteeism, nor should we expect it to be. The effect that we see is possibly the one that we would most expect to see, which is school-based health centers help kids who normally have good attendance have better attendance, right? By providing healthcare access and providing healthcare within the schools, we have fewer students who are at risk of chronic absenteeism. If we could advance the slide 2. One more, please. Yeah, great. Thank you. So the last topic that I want to mention, because this is an area of challenges or opportunities, is I mentioned that at our meso level study, we hypothesized that we might see an impact of school-based health centers on community collaborations. Does the presence of a school-based health center lead to greater engagement among community social service providers and local public health agencies with the school-based health center as a facilitator of those engagements? Our research so far indicates that there are less effects in this dimension than we expected. In this diagram, I'm showing thick connectors between the school-based health center and the schools, right? Because they have very good connections and very good collaboration, but only dashed lines connecting school-based health centers and local nonprofits and social services agencies of local governments. This is an area that our qualitative work suggests there are several barriers to these collaborations, some of which are simply resource-based, others of which are more siloed perspectives. But this is one of the areas that we're continuing to focus on in our ongoing research. And if you could pull up the last slide. Thank you. So in terms of other challenges for rural school-based health centers, resources are an important challenge overall. All rural healthcare providers face staffing shortages and turnovers. School-based health centers serve patients regardless of ability to pay, and so funding sustainability is always an issue. The piece that I want to mention here, and this again echoes some of the themes that were put forward in the introduction to the conference and the keynote speech, is that the biggest challenges these SBHCs face are the difficult social and economic environments of the region, right? The foundation of our collaboration at Cornell with Bassett Healthcare grew out of the school-based health centers' concerns about their limited ability to overcome the challenges that students face due to their social and economic environment. We're working with them to understand from the basic research side, what is the impact of school-based health centers in this region, but also working with them and an advisory board to our grant to learn from that basic research we're doing to think more about innovations in service provisions and external collaborations to more effectively address the challenges that students face in these areas. Thank you very much. And again, apologies about my camera. That's the end of my presentation.
Yes, thank you. I think we're going to keep going. Thank you so much, Sharon, for that wonderful presentation on school-based health centers. And Erin, you have the floor, and then Katrina will follow. Thank you.
Great, thank you. That was a wonderful presentation, Sharon. And so today I'm going to be talking about school food and physical activity environments and health. And I did want to mention that given the important role of policy in the school environment, a lot of my talk today will also have a policy layer. So next slide. So I'm going to cover a lot in my 20 minutes. We're going to talk about the food environment, local wellness policies, and physical activity environments in schools. And I want to draw your attention to the schematic on the right. This is a schematic I use when I think about school policies and school environments, because there's so many layers that impact how we operationalize food and physical activity environments in schools, from federal policies to state policies, to school district policies, to school building policies, and even classroom policies. So really, these different layers can really make a big difference, and we'll kind of touch on a lot of these today. So next slide. So I'm going to start with the school food environment. And usually when I give a talk, I would be in a room with a lot of people and I'd ask you all, in what ways is food sold or provided to children at school? And usually the folks who answer right away say the school lunch and breakfast programs, which are programs lots of folks are familiar with. Maybe you participated in them yourself when you were in school. Some things that people are less familiar with are snack foods that are sold in schools. So these are sold in cafeterias, school stores, vending machines, and these are regulated through a federal program called Smart Snacks. And we're not going to get into that today, but this is something that the federal government oversees. There's another federal program called the Federal Fresh Fruit and Vegetable Program that we're not going to get into, but this provides fresh fruits and vegetables to children in schools that serve lower income communities. And two things that people don't often think about that ways that kids get food during the school day, and usually for free, is through celebrations and rewards. And as you might imagine, these are foods that are often very high in calories. And so these can be regulated through local wellness policies that we'll get to shortly, but I just wanted to mention that this is a way that kids get food during the school day. And then after school, we have a federal at-risk snack and supper program that we're also not going to dig into today, but is another avenue for kids to access food during the school day. So given our limited time, I'm going to focus just on school lunch and breakfast. So next slide. So if you are not familiar with these programs, they have been around for well over 100 years. So the initial lunch program started in communities in the late 1800s as a community-led effort to feed kids during the school day. And they were more formalized in the 30s through a commodity donation program led by the federal government. And then the National School Lunch Act by President Truman in 1946 developed the National School Lunch Program that looked very similar then to what we see today. So a lot of the same components have been around since 1946. And then in 1966, under President Nixon, we saw the addition of the National School Lunch or National School Breakfast Program. Next slide. So in those early years, when we thought about National School Lunch and Breakfast programs, they were really about preventing conditions related to undernutrition. They were there to address food insecurity and micronutrient deficiencies. But as we fast forward to the more recent years, the last 30 years, we're focused on preventing chronic diseases related to overnutrition. But at the same time, we're still dealing with food insecurity and micronutrient deficiencies. So these programs end up addressing a lot of different aspects. And given the current administration's focus on chronic disease prevention, this could be a great avenue for addressing chronic diseases moving forward. I did want to mention probably the most important piece of legislation for school nutrition in recent years, which was the Healthy Hunger Free Kids Act of 2010, which was a major overhaul of school nutrition standards to align them with the most recent dietary guidance. So next slide. And we have learned a lot about the impact of updating nutrition standards and school meals to meet the most recent guidance to address chronic diseases from the Healthy Hunger Free Kids Act. This is just a few of many papers that have come out to show the impact of these nutrition standards. And I won't go into great detail in the interest of time, but the first study listed here from 2016 showed that after the meal pattern changes, there was an improvement in nutritional quality and decreased energy density of foods chosen by students. And importantly, they saw no difference in meal participation. So if we improve the content of school meals, make them healthier, kids are still participating. Fast forward to 2020, a study using NHANES data from prior to the changes and then looking again at after the changes to the Healthy Hunger Free Kids Act, they again saw improvements in diet quality, specifically among children from lower income families who are more likely to participate in school meal programs. And then finally, a more recent study did an interrupted time series using the ECHO cohort and found decreases in BMI Z-score following the nutrition standards implementation. And this paper was really important because a lot of modeling studies had predicted that this might happen. And this was the first to show using data that there was an impact on BMI Z-score. So again, when we think about child health and chronic disease prevention, school meal programs may be a really great avenue for considering how to improve child health. Next slide. And so within each section, I'm kind of wrapping up by presenting some research opportunities. These are just my ideas. I'm sure there are many more research opportunities out there, but I did want to mention a few bits from things that we've been thinking about in my program. So I talked about how lots of studies looked at the impacts of the Healthy Hunger Free Kids Act meal pattern changes. Well, there are new meal pattern changes coming. So there were flexibilities introduced in 2023 following the COVID-19 pandemic. By the way, we learned a lot about school nutrition programs and implementation during the COVID-19 pandemic. But since then, again, these flexibilities were introduced. And then in 2024, there was another overhaul of the school nutrition standards that'll be implemented from 2024 to 2027. So slow roll implementation, including limits on added sugar and sodium. And so this is another ripe opportunity for research using similar methods to what we saw with the Healthy Hunger Free Kids Act changes. Participation continues to be a barrier with national school lunch programs. We see participation drop-offs as kids get older, and there are lots of reasons why people think this might be, including meal quality, whether it's perceived by the students or real. Also stigma, time in line, lots of logistic concerns. Again, we need to dig more into these participation barriers and identify ways to overcome those barriers to improve participation. We also learned a lot again during the COVID-19 pandemic about access to school meals, given that universal meals were provided across the country for a period of time. Since then, many states have adopted universal school meal policies. Because it hasn't been universally adopted across the whole country, it's another ripe opportunity for research to do some natural experiments. And also the community eligibility provision, which also came from the Healthy Hunger Free Kids Act, which allows entire schools or school districts that serve lower income communities to provide free school meals to everyone in the school, regardless of those individual free and reduced price meal applications. So CEP has really expanded in recent years, in part due to different ways that we can calculate community eligibility. And so given that, again, it's another ripe opportunity for research into access. And then finally, and again, the past few years, there's been a big focus on increasing local procurement of foods, scratch cooking in schools, other ways to improve school meal quality. Also, again, great opportunities for research to understand the impact of these different approaches. So my research program, we're doing a number of things right now. We are developing measures of perceived school meal quality and cultural responsivity of school meals. Interestingly, we don't have really good measures of these. We talk a lot about how much these may matter, but it's hard to know how much they matter if we don't have a good way to measure them. So we've been working on this measures development project over the past few years. We are also doing an analysis of the impact of direct certification with Medicaid and CEP. So I mentioned there are different strategies for calculating community eligibility, and this is one approach. And I should mention these first two bullets. We have oral presentations at APHA presenting these data. If you go to that meeting in the fall, we'll be presenting that. We also, for those of you who are school practitioners working in school buildings, we are piloting the provision of school meals to adults in school buildings. So in the context of free school meals, can adults also get free school meals? And so that's been a really interesting project that we're working on now. And we're doing a systematic review of school nutrition programs and academic outcomes. So next slide. And so now I'm going to move on to talk about local wellness policies. Next. So I could talk about local wellness policies all day long. I love talking about these. We've been working on wellness policies in my research group for a long time now. If you're not familiar with this concept, they were formed through the Child Nutrition Reauthorization Act of 2004. And what this bill said was that every school district in the US that participated in school meal programs had to have a written local wellness policy in place by September of 2006. That was a long time ago. And every school district did this. They had a policy, and the policies outline rules for nutrition and physical activity, access and promotion during the school day, again, in a written document. So federal legislation passed, written local wellness policies existed. They weren't necessarily implemented. So there was not a lot of incentive to actually implement the policy that was put into place. But the idea was if they were implemented, which takes place at the district level and to a large extent at the school level, it would lead to enhanced opportunities for health and wellness among students, and then improved child health outcomes, and maybe also academic outcomes. And so this was the reason why we have local wellness policies. But again, they weren't necessarily being implemented. Next slide. So that takes us to, again, the Healthy Hunger Free Kids Act, which included language around local wellness policy implementation. However, the final rule for wellness policy implementation didn't go into effect until July of 2017. And it had a lot of language around how we can better implement these policies. And I would argue the most important part of this legislation has to do with these triennial assessments. So what this means is that every single school in a district has to report to their district and then the districts report to the state on how they're doing around wellness policy implementation. So monitoring is a great way to encourage implementation of policies. And so keep in mind, this is a triennial assessment. So it passed in 2017. That means the first triennial assessment wasn't due until 2020, which of course, given that that was in the height of the COVID-19 pandemic, it got punted to 2021, which of course wasn't a normal year either. And so it wasn't until just last year in 2024 that we saw our first real triennial assessment conducted in schools around the country. And so this is, although this is a policy that passed in 2006, we're now just possibly seeing the real impact of wellness policies in schools in just the past year. So next slide. And I did want to highlight a project that we had in place in Maryland for 8 years. And in part of the reason we implemented this project in partnership with our state departments of education and health is because we saw the language in the Healthy Hunger Free Kids Act around implementation. And so the idea was to set ourselves up for a natural experiment, of course, never imagining that it would take until 2024 for this to really kind of get off the ground. But the idea of the project was to enhance opportunities for healthy eating and physical activity for Maryland students by helping schools and school districts create and implement strong and comprehensive written local wellness policies. And so we did this by looking at the quality of the written wellness policies. We then looked at implementation of policies using an administrator survey in schools and a district survey, and then using data we had available looking at the impact of these policies. And in Maryland, we have 24 school districts because every county is a school district. So we're in a pretty unique situation. But in this project, we used a continuous quality improvement approach where we collected data, provided tailored feedback to districts with our partners at the state departments of education and health, provided technical assistance. That support would then lead to district level initiatives, ideally, which would then lead to school level initiatives, which would ideally be detected through our school level survey and then again and again. And we were able to do this through 4 phases of data collection. Next slide, please. So we learned a lot through this project. I just wanted to highlight one of the key themes of research that emerged from the Maryland Wellness Policies and Practices Project, which has to do with school-based wellness teams. So the first paper we published from this data looked at factors associated with wellness policy implementation, and school-based wellness teams were a primary factor that emerged. And when we say wellness policy implementation in this study, we're talking about best practices related to nutrition and physical activity measured through that administrator survey. We then dug into active wellness teams and what those look like. So they're meeting best practices around how often they meet, who sits on the committee, whether they set goals, things like that. And of course, among schools with wellness teams, those that achieve more of those active wellness team components have greater wellness policy implementation. And then finally, the last paper I wanted to mention is one of my favorite figures here on the right, where we looked at over 2 time points, whether the schools had a wellness team and how that tracked on to wellness policy implementation. The bottom purple bar are schools that never had a wellness team, and they consistently report low levels of wellness policy implementation. The upper bar are schools that consistently had a team, high levels of wellness policy implementation. The green bar, you see that those are schools that lost their wellness team over time and their implementation goes down. And then again, the blue bar are schools that built a wellness team and you see implementation go up. So next slide. So using these data, we were able to work with our Department of Education on a USDA Team Nutrition grant to develop an intervention where we would train teachers to lead wellness teams in schools. And we called this Wellness Champions for Change. And using, through the pilot study, we looked at school level impact using a randomized controlled trial model. And it worked. We were really excited. We saw that the teacher training indirectly led to higher wellness policy implementation via the formation of active wellness teams. And that led us to a larger randomized trial funded by the USDA, which looks at the added impact of student-led wellness teams and the student level impact. So next slide. So as exciting as that sounded, I just wanted to mention that the COVID-19 pandemic completely disrupted our study. So even though we were able to recruit and evaluate so many schools and individuals, we were unable to be powered to look at the primary aims of this study. We did learn a lot along the way about implementation of the intervention, feasibility of the interventions, and we're very proud of what we accomplished, but we sadly were underpowered to look at the ultimate outcomes, which were the impacts on students. So next slide. So again, having said that, the intervention was well received. Again, we learned a lot about implementation. I have 2 slides on what the intervention looked like. I'm not going to get into great details about them. I know that these slides are available. So if you want to learn more, please reach out. But the teacher training involved a full day training plus a lot of support from us around goal setting and creating an action plan. And again, we also made this into an online course for teachers. So there are lots of opportunities for partnership if people are interested. Next slide. And then the Student Wellness Champions for Change curriculum included 10 structured lessons focused on youth advocacy and public health literacy and developing leadership skills. The students did a photo voice needs assessment, again, created an action plan. And so this is another curriculum that we're very proud of how it was implemented, but we were not able to ultimately see the impacts long term. Next slide. I wanted to wrap up by mentioning wellness team structure in Maryland is very unique. We have a state school health council that's required by law. We have local school health councils, which are also required by law in every district. Wellness teams are just recommended, not required. But within the structure, we really promote best practices throughout the state. We're actually having a webinar today on strengthening wellness policy implementation and monitoring, where we're going to hear about the triennial assessment results from last year. So this is very timely to mention that this is really happening in real time right now. Next slide. So as far as wellness policies are concerned, this triennial assessment could be a really great opportunity to evaluate implementation and impact, especially depending on where you're located, your districts, your states. It'd be a great way to get involved, especially with a school nursing background. We are still looking at the impact of school-based wellness teams. We know some of what they can accomplish, but it'd be great to see more about impacts on students and academic achievement, for example. The CDC has funded 20 states to work on building state-level school health councils, similar to what we have in Maryland. If you are in one of those states, I definitely recommend finding out more and seeing if you can get involved. Then my research program, we continue to analyze data from the projects I just mentioned. We're looking at collaborations to deliver the teacher training more broadly, and we have a grant under review to develop district-wide student wellness champion opportunities. All right, next slide. I'm running low on time, but fortunately, I don't have much, or unfortunately, I should say, I don't have much to say about physical activity policies and environments. So next slide. I start by saying, again, how are children active in school? People think often about PE class, recess. Other ways kids are active include physical activity breaks or brain breaks during the school day, integrated physical activity into classroom lessons, and of course, active transportation getting to and from school. So these are kind of the big 5 ways that kids are active during the school day. Next slide. This section is fairly short because there are no federal physical activity policies that exist. It's recommended that schools or districts bring on a CSPAP, or a comprehensive school physical activity program, that includes those 5 things I just mentioned. PE, of course, is often incorporated into some sort of district policy or state policy, but all the other pieces are usually not, and they can be incorporated into your local wellness policy if you're looking for a way to formalize these physical activity opportunities. Next slide. At the state level, if you're unfamiliar with the NCI class data set, I highly recommend poking around. It's a great resource on nutrition and physical activity laws at the state level, and they create these maps. This is a map of the US, so it kind of looks a little different, but you can see these are the current data on recess policies and where we are across the country. Next slide. So again, as far as research opportunities, lots of natural experiments and that could be done to look at different PA policies, given that they are very sparse. You can create natural experiments. Cost benefit analyses are always important to look at when we're thinking about academics and school settings. And again, linkages with academic outcomes. We're developing a toolkit for state level recess policies that will launch on October 6th in Washington, D.C. We're also doing a multi-stakeholder study of implementing middle school or recess in middle schools, and an umbrella review of activity breaks and academic outcomes. So next slide, just summarize.
Karen, you have about 1 minute left.
Yeah, I know. I know I was short on time. Okay. So just again, we talked about school meals, federal policies. We talked about physical activity, local wellness policies, and lots of opportunities for research. I did want to show the next slide in my last minute just to say, if you're interested in getting involved, especially as a school health practitioner or community member, there are lots of ways to get involved. Reading your district policy, joining one of these health councils at the state or local level, at wellness teams in schools, there are lots of opportunities on how to build wellness teams. I do co-chair a CDC school wellness working group, and the information on that is on my final slide. So if you're interested, please contact us to learn more. Our website has a lot of resources, which is right here. And then the last slide just mentions that I only talked about nutrition and physical activity, but we do think about policies for the whole child when we build these school-based wellness teams. So it's not just around nutrition and physical activity. We really think about health as a holistic whole child approach. And that's it. So sorry for running a little bit over. The next slide is just my funding. Thank you.
Thank you. And we'll move on to Katrina. Thanks so much.
Hello, everyone. My name is Katrina Dubnam. I'm an associate professor at the University of Virginia. I have a unique appointment, a joint appointment in the School of Nursing and the School of Education and Human Development. And so I'm going to talk a little bit today about sustaining school engagement to improve adolescent health. And when I'm talking about adolescent health, I think my focus is more around social and behavioral health. So you'll see a difference in how I talk about this compared to some of the previous presenters. Next slide. So a quick acknowledgement, the work that I do is team science. And so I always acknowledge the members of some of the members of my team in presentations. Specifically, my current lab is the prevention interventions team. So the collaborative research on engagement and well-being. It is multidisciplinary and transdisciplinary research lab. Our focus is on preventive interventions that optimize implementation of evidence-based practices to improve behavior, classroom and school experiences for youth and school personnel, and reducing kind of the risk for behavioral and mental health problems. So next slide, please. So our work has it started much in 2002. And so as long as I've been a part of it, much of it is school engaged research. And it started thinking about school violence prevention for youth and has spanned over the last a couple of decades, kind of thinking about how we can do this in comprehensive ways and specific ways. And so I'll touch on some of the research that we've conducted, but much of this, I won't spend much time talking about any particular project. And so while the findings that I'm going to present may be based on something that we found in our different research studies, I'm happy to provide more specific references about things, about any specific study that you would see on this slide. Next slide, please. So more recently, our work has been kind of shifted in 2015 with the signing of the Every Student Succeeds Act. And so this act required states to start to think about more non-academic factors in their accountability systems to promote a broader vision of school success that extended beyond kind of traditional measures. So prior to this, most of the school the ratings for schools were largely focused on attendance and academics, and now and that the Every Student ESSA kind of gave us the opportunity to think about more of more non-academic factors. And so it requires states to use an additional indicator. So it could be student engagement, could student climate to track school success. And it also freed up funds to implement programs that promoted these things. And so including school climates and reduce exclusionary discipline. Next slide. So, and we all know, which is why we're all here, is that the concept of school is one of the most important ecological factors that may shape our student or youth development. This visual depicts Bronfenbrenner's ecological theory that shows that the individual, and in our case, we're talking about students, at the center of it all, and is influenced immediately by their immediate family, the school, and play areas in which the student regularly frequents. The exosystem, the next level, is comprised of extended family, friends, neighbors, and the community. These also affect their development. And then finally, they're kind of the societal values, laws, and customs that are in the macro system. Next slide. So what exactly is school climate? And you can release on this slide, you can release all the Yeah, thank you. So there's a lot of literature in this area that allows us to identify some of the core features, what has been defined as school climate. And so it's the quality and character of school life, which fosters child's development, learning, and achievement. And so a positive school climate is one in which there are norms, traditions, ways that interacting positively with one another, values that indicate prioritize high quality education, providing opportunities to students to develop, and an emphasis on fairness and high expectations regarding students' achievement. And so in having these norms, values, and expectations, people in the school building feel socially, emotionally, and physically safe. And so feeling socially and emotionally safe reflects the feelings that one belongs within an environment and that one can disclose about themselves, about the fear of judgment and punishment, and feel understood and accepted. And then feeling physically safe means that one is free from fear, victimization from peers. And in these schools, members of the community are engaged and respected and work together to contribute to a shared school vision, and that they feel responsibility and ownership for the space and care for its physical appearance. Next slide. So these main components of school climate kind of map well onto Maslow's hierarchy of needs, which I'm sure you're all familiar with, that in order to reach, which is said, in order to reach self-actualization, one's full potential, all the other foundational needs must be met. And so taking through the lens of a school with the full potential being academic achievement and successful completion and ultimately kind of post-educational successes, we think about these things needed in a school environment to ensure student success. And so psychological needs include rest, health, school, water needs, which many of the presenters have talked about and will talk about today. So general wellness that needs to be taken care of prior to achieving anything. And so this recognition, this is why our schools provide a variety of resources such as free and reduced price meals, vision screenings, and all the other services that many will talk about. The next level, there's safety needs. So these are clearly mapped onto the safety component of school climate, where the students need to feel safe learning environment where they're free of victimization with the school, but also en route to and from the school building. Loving belongingness has to do with the human needs to feel bonded to others and maps onto engagement or connectors within the school, which I'll talk more about in this presentation. So when students feel like they belong, they are more engaged and more likely to reach their full potential. And so these different forms of connectedness assist students in reaching their full potential. Esteem needs are the foundational relate to people's need to feel competent and independent in school, and this can be promoted through an environment which provides positive experiences and supportive of students' needs. And so this relates to the belongingness and engagement I just mentioned. And then environmental features, so like the quality of the school facilities help to meet students' physiological needs. And so setting norms around orderly and calm behavior that relate closely to safety and make the school visually appealing, which affects students and staff morale. Next slide. So school climate then refers to the attitude of the school and its effect on people's and experiences of life. And so this is the definition that I have generally used in thinking about school climate. Next slide, please. So the U.S. Department of Education put forth this model school climate that include these three kind of larger constructs to take into consideration when you're trying to improve this in schools. So safety and engagement and environment. So safety includes being free from the fear of victimization, which I was mentioned already a few times, in its many forms, and not being exposed to unhealthy behavioral choices. So like substance use, that can then in turn make an individual more likely to engage in unsafe choices. And so students who feel safe in school can attend to their academic tasks. Engagement is referred to the connectedness or belonging, but also has to do with how students and staff interact with one another and the academic content is delivered within the schools and classrooms. And then environment, of course, relates to the physical features of the building that provide students and staff with a positive feeling about the school, as well as the structures and supports that facilitate positive norms and behavior and address the students' needs through services. So by providing an environment that is visually appealing, comfortable, and provide students with a quiet and calm needed to learn, they can focus more consistently on their academic content. Next slide. So much of my work in this space has been thinking about how do we measure school climate. And so there are bodies of literature devoted to each one of these different components of school climate. And so I talked a little bit already about safety, which includes measures of substance use. And so how often are students engaging in behaviors related to substance use and drugs in the school building, but also outside of it. Physical safety, how physically safe do they feel in the environment, and getting fights happening and all other types of interactions that are happening in the school environment. And then, of course, bullying and aggression, which is really a big area of research that has a tremendous impact on student health. Engagement is where I'm going to spend most of my time today, thinking about connectedness. So we're talking about how students feel connected to the school, to the teachers, and to other students in the building. We're talking about academic engagement. So how engaged is the content that they're experiencing in the classrooms. Fairness, how fairly they feel like they're being treated. And then, of course, parent engagement, which is one I'm not sure anyone has talked about a lot yet. And then environment, of course, is we mentioned already, the physical comfort and cleanliness, the rules and consequences when misbehavior or problems occur in the classroom, and disorder that may be present in the schools, and then whatever support services that may be available for students in these buildings. Next slide. And so I'm going to focus today mostly on engagement. So thinking about strong relationships between students, teachers, and families in schools, and how those connections between schools and how the connections between schools and the broader community. Next slide. So thinking about engagement. So first I want to kind of talk about student engagement. And so student engagement is kind of a nested developmental process, meaning that students can engage in a specific learning activity in one moment in time. But this instance of engagement occurs in the context of how they engage and they feel in their classroom, which is shaped by how they feel engaged in their school, and then in turn engaged in their community. So all of this shifts over time with developmental changes while children are growing and learning. For student engagement, we're also talking about meeting these core kind of psychological needs in the context of caring, warm, and supportive relationships with adults and peers. And so this boils down to belonging. So how we are supporting students' sense of belonging at school can focus on efforts to proactively build community, opportunities for building authentic student and teacher relationships and peer-to-peer relationships, their competence. So like the provision of classroom goal setting opportunities focused on mastery, challenging learning activities, academic tasks that set high expectations and clear feedback on academic performance. And then lastly, autonomy. So what are the ways we're giving meaningful opportunities for agency to students? These are all components of student engagement. Next slide. Next, I'll briefly touch on family engagement. So, much of the literature related to family engagement has focused on one component of family engagement, and that's parent involvement, which is just one component of family engagement. And so this research has highlighted the importance of parent involvement. If children are to do well in school and feel healthy, they need parent involvement. And so, for example, a study of low-income children who were followed from birth to age 23 found that parent involvement in middle school can positively impact future high school graduation. Academic socialization is also related to parent involvement. So it includes us communicating parental expectations for education and its value or utility, and linking that to the schoolwork or current events, and fostering educational and occupational aspirations. And so discussing learning strategies with children and making preparations for the future. And so these are the components of family engagement that I would argue don't get as much, haven't gotten as much attention in the literature. Next slide. And then lastly, engagement includes the community involvement and engagement. So this is what happens before and after school in the greatest community, which is also really important to youth and children's success. So community involvement can ease this transition period for students grappling with issues of authority, independence, and changing relationships within their families as they're developing. Before and after school programs, or we call them out of school time programs, provide students with academic programs programs, specialty kind of STEM, sports teams, arts enrichment, and multi-purpose programs that provide an array of activities. And research has shown that out-of-school type programs have a significant positive effects on students' achievement in math and reading and their feelings of health and safety. Parents and families gain additional, access to parenting workshops, GED, educational programs, family counseling. And finally, the entire school often benefits from beautification projects or donation of school equipment and materials and activities for school staff, as well as professional development and classroom assistance. So the community engagement part is another really important part that we don't talk enough about. All right, next slide. So, I wanted to kind of end on this, on reviewing some of the literature related to school climate and its association with important health outcomes. And so, next slide. Next slide. And so when I'm talking about school climate, I'm talking about all those different components that were of that model. And you can release all of the bullet points on this slide as well. And so in the literature, we see that positive school climate, so this global concept of school climate is associated with reduced discipline problems in schools for individual students, reduced suspensions for students, regardless of their background or identity. We see that it results in is associated with a less aggressive and violent behavior. So those feelings of safety, and is associated with less problems with absence of lateness. So this kind of attendance and being present in the school. And then it's also associated with less alcohol and drug use, and reductions in bullying. So lots of positive outcomes related to positive school climate. Next slide. And you can release all these bullets as well. So it's also, these are the positive things that it's been associated with. And so positive school climate associated with these kind of student academic motivation and engagement, student achievement, psychological well-being, and for adults, teacher job satisfaction and retention. And so there's some references here that I'm happy to share with you at another time if you'd like to learn more about any of these individual studies. Next slide. And then negative school climate. So when we talk about the reverse, so like what does negative of school climate mean for students? And so it often results in less engagement with education, less feelings of health and safety. So poor student achievement, poor physical health. So resulting in sometimes in risky behaviors, poor emotional well-being, and youth of color tend to report less supportive relationships. And so lower perceptions of fairness and perceive their environment as less safe. All right, next slide. And so these are just some, I wanted to briefly kind of just mention some of the impacts that not just students, but also the teacher and the staff in the building. So these are the people that we need their support from, right? So less increases in classroom disruption, less instructional time, decreases in staff motivation, and increases in burnout. And so, of course, a lot of the literature in this area has focused mostly on teachers, but it is kind of assume that these are the experienced by not just teachers in the building, but all staff. And so that includes school nurses, that includes school counselors, administration, everyone. Great. Next slide. So I want to, in the presentation, just touching on some of the research successes and gaps and opportunities that I've seen in this space. Next slide. So, what I've tried to convey is that school climate is a critical and kind of malleable feature in school life that affects the extent to which youth, adolescents engage wholeheartedly in learning and have positive health outcomes. And so a positive school climate can support students' core psychological needs for emotional connection to peers and adults in the building, competency development, and a sense of mastery as they learn, and a growing sense of independence and autonomy as they transition towards adulthood. And so these three school climate domains of engagement, safety, and environment that I highlighted hold a lot of promising evidence-based interventions to improve school climate and during school during the school transitions. School climate is nationally recognized as a distinct measure of school quality and has effects on the interactions and relationships and learning and leadership practices and organizational structures between students, teachers, and administrators. Finding successful ways to increase family and community engagement with schools is sometimes challenging, but it is a critical pathway, increasing mutual access to resources for students, families, and teachers, and one that I think most studies have shown really positive effects on. The physical environment of a school can promote or hinder conditions for learning and student physical health through the provision of basic resources, so clean and sanitary facilities, safe drinking water, comfortable temperatures, and food security. And so it may also communicate to students how valued their needs are to the adults responsible for their well-being, which may have lasting impacts on their emerging sense of identity and social position during adolescence. Next slide. So as I briefly mentioned, there are whole bodies of literature attached to each of these different components of school climate. One of the major gaps that I see is that there's a lack of comprehensive interventions to affect all of these important elements, is that we tend to take them on one at a time, and they become when combined together, they create they tend to be too large for schools to be able to implement with any fidelity over time. And so this is one of the major gaps that I see consistently consistently over the years, and related to addressing these particular issues, that there are interventions and evidence-based practices for each one of them, but when you put them together, they are hard to implement for school at the school level. Next slide.
Katrina, you have about 30 seconds left.
All right, this is my last slide. So want to quickly touch on that, restrictive school security measures have potential to harm students' sense of emotional safety in school environments. Instead, investing finite resources and promoting student emotional safety through bullying prevention, social emotional learning, and mental health services is recommended by most people in the education space. Clear, proactive, and positively stated rules and consequences are a necessary foundation for supportive schools for students. And particularly at middle schools, can increase their student engagement in school by supporting their sense of belonging, feelings of competence, and increasing student opportunities for autonomy. So I think next slide is just my thank yous, and so I will end there.
Awesome. Thank you so much for that great research. And next, we look forward to Kathleen's reflection on this panel.
Good. Well, I think we're almost in afternoon now. So good afternoon or good morning to folks who are still in the morning hours. Thank you so much for having me. I'm Kathleen Ethier. Until January, I was the director of the Division of Adolescent and School Health at the Centers for Disease Control and Prevention. And so really appreciate the opportunity to reflect on the really wonderful research that all of the presenters just provided for us. I think, when I looked at the various presentations and had some conversations before this panel, I really wanted to focus on the research to practice. There are, of course, incredibly powerful practical implications for everything that the presenters talked about. And so I'm kind of thinking about it in 4 ways that I'll just kind of put out there up front. One is how to best use research and data to inform practice. And I can give you some examples of the ways that we did that in the Division of Adolescent and School Health. The second is the importance of demonstrating impact on outcomes associated with programs, interventions, strategies that we put into schools. And then even when we do that, some of the challenges that we're still faced with. I really want to focus for a couple of minutes on the connectedness and engagement, and kind of talk about how we translated years of dedicated research on this. And thank you so much for such a wonderful presentation that pulled all of that together, and to talk a little bit about how we translated that research into practice. And then I do want to end, given the topic of the day, I do want to end in talking about the value of school nurses in all of these efforts. So let's talk for just a minute about how to most effectively use research and data to inform practice. So I think many folks would know that in the Division of Adolescent and School Health, we have the Youth Risk Behavior Survey, and we also have School Health Profiles, which is probably one of the lesser known data systems. And those are surveys that are kind of implemented by almost all states. And it is asking middle school and high school principals and lead health teachers to fill out surveys about kind of what is done related to health in schools. And it's a really wealthy kind of trove of data about what's happening in schools. I think, a couple of people touched on the fact that there is oftentimes, for instance, related to school-based health centers, not adequate data. And certainly the national and state data sets that we have are, what I like to think of as a mile wide and an inch deep, right? We're trying to address so many different issues in those surveys. But I think, one of the things I think about a lot is as we design our research projects and as we design our data systems, really thinking about how they will inform practice is really essential. And then, we think about this a lot with policy, evaluating the impact of policies. What data systems, what large data systems are out there to evaluate the impact of policies? And several of the speakers kind of talked about looking at schools that implemented X versus those that didn't, or looking at states that implement a particular policy versus those that don't, are very important big picture ways of being able to make the case for why a particular approach, a particular strategy is really essential. One of the things that we also did in DASH was to make sure that we were translating our data in ways that could be easily communicated. So a number of years ago, we started, when we realized that, we were putting out like these large tomes of YRBS data that no one was reading. And people would pull like the little pieces of data that were important to them, and they would use those statistics. What we started to do was to package our data in ways that was really easily accessible into what we called our data summary and trend reports. And that would be to take like a 10-year look and look at trends, look at breakdowns by demographics, and just take the data, particularly areas that were really important to the work that we were doing, and make sure that we were translating it in ways that was useful and digestible. And I think here, when we're talking about research studies, the people that we have to convince to either fund or implement or use our research projects are not scientists. And so really thinking about how to translate our research and our data into useful and usable messages, I think is incredibly important. Which brings me to the second point that I wanted to make, and that was the importance of demonstrating impact on outcomes. And this is incredibly difficult and can be very costly, but it can be in some ways the make or break between whether or not there is wide scale adoption of the policies and programs and practices that we would like to see schools make. I had a meeting recently with I've been working on supporting an organization that is focused on youth service learning, and which has a long history of strong scientific support. And we went to meet with a state education agency to talk to them about their service learning programs, to see if we could help design some evaluation of the programs. And in my head, I thought, oh, well, let's see if we can connect it to health outcomes. And when we met with the organization, they were like, no, for us, it's really absenteeism. And so being mindful of what it is that will convince a school district that they should make, in some cases, financially, they're going to need to put some money toward a particular approach, you really need to be able to translate that into outcomes and demonstrate into outcomes that that's going to be something that's valuable and it addresses something that they want to address. I will also say, and I thought about this a lot during the presentation on school-based health centers, we've made great strides. When I first started doing this work, 25 years ago, there were very few school-based health centers. And even then we were able to demonstrate through research that young people who had access to school-based health centers did better across a variety of outcomes than those that did not have that access. And I really think looking at that in rural settings is key as rural areas lose more and more of their healthcare infrastructure, and in some cases can be the only way that young people have access to primary care, for instance, and then other kinds of healthcare. But the resources required to implement a school-based health center may be prohibitive, and so I think, in some ways, no matter how strong the research is, it can be really difficult when it requires resources in areas that are poorly resourced to be able to implement that. So I would love to have more conversations and think more about how we can help convince areas that they need to put resources into this work. And then I'm sure I don't have very much time, but I did want to just touch on the importance of the connectedness and engagement focus. We found in our work that social isolation and then therefore connectedness underlies so much of the social and behavioral and well-being issues that young people face. There is a long body of research that shows that young people who feel more connected in their schools and to important others in their schools and their families as well have long-term impacts well into their late 20s and early 30s, and probably on, that's just where the data ended. So it's probably far beyond there. We translated this sense of connectedness and how to create that sense of connectedness in a couple of ways through our What Works in Schools program. One was through classroom management. And, we got a lot of questions about, like, what do you mean, why is classroom management a source of connection? And I think it gets at exactly what was in the presentation about the feeling of safety and addressing that kind of really basic need that when you're in a classroom and it is well managed, and for those of you who've worked in schools and you have seen poorly managed classrooms, you will see that that is an unsafe space. And so, and it doesn't mean that, kids are sitting in their chairs and not being engaged. So I think that the combination of safety and engagement is really, really key. The other thing that we did, we focused a lot on youth development programs, both service learning programs that got young people out into their communities and connected them to important community organizations and adults, and then mentoring programs which brought important adults out of communities into schools. And I think those were really key in enhancing the connectedness. And then I think one other piece that we focused on that got at a lot of what was in the presentation was making sure that there were clubs that helped young people be connected, that the spaces where young people collected were safe for them, that there were policies that were enforced that were anti-harassment policies, so that bullying and harassment was clearly not acceptable, and that there were consequences for it. But also the final piece was making sure that educators had training and understood why creating this sense of safe and supportive environments was so important for kids. And I think when we did those things, what we saw was that the schools that put those activities in place versus those that didn't saw improvements across a whole host of behavioral and mental health outcomes. And so for us, that just reinforces, I think, taking that research and putting it into practice. What we see in terms of what's going on in our schools is, we see the embodiment of the great research that's been done. I'm just going to end by saying school nurses have an incredibly important role to play in each of those. they come from a scientific background, so they have an understanding of science and an understanding of research and data, and are key to being able to use that information effectively. I think they are the key healthcare providers, particularly in schools where there are not school-based health centers, but even in schools where there are school-based health centers, they're a really important liaison to those services and also to families. You know, we talk about young people really need at least one person in a school who is there for them. And I think in many cases, school nurses provide that sense of connectedness, and provide that, you know, kind of safety. And so I just, you know, in my work in DASH, we forged very strong alliances to the National Association of School Nurses, understanding the value of what they do. And we also did some research that showed that for every dollar spent on school nursing programs, they saved, more than a couple of dollars in costs, both healthcare costs and quality of life costs. So just wanted to end there with really kind of holding up school nurses as such an important source of all of these supports in a school. And I'm guessing I'm out of time, and I'll stop there. And I know we have time for some questions.
Yes, thank you so much, Kathleen. That was a great reflection. Appreciate that practice perspective. So if Sharon and Aaron and Katrina could please come on camera. We do have a few questions for you all. Just let the audience know that we are keeping track of all the questions coming in. We will try our best to address them. If we can't do so right now, we will do so at the end of the day during today's session. So if you can give some brief remarks for these questions. The first one is about school-based health centers. We know that they work, but many do require parental consent to access, but it is not needed to access the school nurse. Can you speak to this difference and its impact on school health research, Sharon?
Well, the functions of the school nurse and the school-based health center are complementary but different, right? So it is true that a school-based health center is a health clinic, and students have to enroll with parental consent. Appointments are typically made, certainly for elementary students, with parental consent. So it's not the same environment as access to the school nurse, right?
Okay.
And so there are some challenges associated with providing care. One of the things I didn't get a chance to mention due to time constraints is I mentioned there were 24% of students who didn't access the school-based health care, the school-based health center, even in schools where they had potential access to it, right? So there are some barriers to overcome in terms of getting enrollment and access for kids, and that's associated with the nature of parental involvement. Yeah.
Got it. No, thank you for that clarification. Aaron, can you answer a few questions on first, so how do we handle open campuses in high schools? How does that impact meal quality? Any thoughts?
So it's something that could be addressed in a wellness policy. I know in Maryland, we have one district that had to update their wellness policy to prohibit Uber Eats being delivered to the campus for many reasons. There are safety concerns. It's taking up time of the administrative staff to answer the door, and lots of reasons why they don't want that to happen. Open campuses aren't very common in Maryland, so I would have to defer to colleagues in states where that is more common. But participation drops off, like I said, precipitously starting in middle school, but then certainly in high school as well. And so working with youth, we do a lot of youth engagement in the work that we do to try to understand ways to encourage meal participation. It's certainly an important strategy just to figure out how to overcome those barriers.
Thank you for that. And so I'm gonna ask a follow-up question. Just thinking about state level school wellness councils that you discussed, and also the school cafeteria environment. Erin and then Katrina, if you can answer this, can you talk a little bit about expected health outcomes from those? So Erin, the wellness councils and the school environment. Then Katrina, I'd love to get your thoughts on that too.
Sure. So a big purpose of our state school health council is to kind of share best practices across districts. The idea is that districts in a single state are probably more similar than districts across states. And so we can share best practices amongst those in the different areas of the whole WISC model. So we have representation from all areas, great representation from nursing, for example. And so the idea then would be to understand ways to overcome barriers to implementing some of the best practices that we know are related to health outcomes. So that's kind of the idea of how to move the needle with respect to the state school health councils, and they support the local school health councils. So that way, there's this kind of triangle down to ideally to the schools. And then as far as the cafeteria environment, so what was the specific question about the cafeteria environment?
How does that affect health outcomes also?
So if we think about the holistic environment, we think a lot about that when we were working on our project to develop a measure of perceived meal quality. We used, again, a youth engaged approach. We had a youth advisory board, and we talked about the environment. We actually did a guided meditation with them where we walked them through, we walk into the cafeteria. What do you smell? What do you see? What do you hear? And kind of thinking more holistically about how other aspects besides just the food impact your willingness to eat the food and get the food and stand in line for the food and kind of those different aspects. And we know that school meals are consistently healthier overall compared to meals packed from home. And so encouraging kids to consume those healthy school meals, especially when they're free in areas where kids have free access to school meals, is a priority. And so addressing the overall cafeteria environment is one strategy for hopefully improving meal participation and consumption.
Awesome. I love that guided meditation piece. Wonderful approach. Katrina, any additional thoughts on the school environment and health outcomes? And also, you talked a little bit about evidence-based practices and how overwhelming they are. Are there some easy wins for school leaders who can adopt and predict better outcomes?
Ooh, it's a big question. So I'll start with the school environment. I mean, I think that one of the things I think that maybe Erin mentioned was about, like this idea of free and reduced lunch is and creating an opportunities for students to have greater access to food. And we can talk about what kind of food it is and the policies around it, but actually having breakfast in many of these school districts is important to getting students started on the right foot at the beginning of the day. And so not just at lunch, but starting the day off like feeling fed and well will increase reduce kind of like misbehavior and increase their ability to engage and connect throughout the day. So that's one thing that research supports that. And so I'll say that. And then as far as evidence-based practices are concerned, I mean, I don't think, there are a wealth of practices and programs that have been shown to be effective. I think the challenge will always be how we translate them into practice, into practices that the teachers can actually implement or school leaders can actually implement in their schools. And so that I think is the challenge. And so there are a wealth of them. I mean, I think there are ones that are school wide. So a lot of my work has been around PBIS, so positive behavior intervention support. So creating structures that are important for that in which other programs can be developed can be used within. And so I'll just stop there. Yeah.
Awesome. Thank you. We have about 1 minute left, but if you all could each touch upon this question that I'll ask, starting with Kathleen and then Sharon, Erin, and Katrina. So how can nursing research using a holistic perspective advance school health intervention research and really address some of these opportunity areas that everyone talked about? So Kathleen, your quick thoughts?
I think to very much focus on the things from a school-based perspective, the things that, like, what are the core things that school nurses do? And how do we establish really the cost benefit and effectiveness of those core strategies and use that to build a case for why it is, how important it is for schools to make sure that every school has at least one nurse.
Thank you, Sharon.
I'd like to emphasize focusing on collaboration and cooperation um, to get beyond what one person can do or what a person with one type of expertise can do. Having multidisciplinary approaches to addressing problems, I think, is really important.
Awesome. Thank you. Erin?
I want to build on what Sharon said. We're big believers in the concept of teaming, which is an implementation science term, but the idea of building a team is not new. But having lots of different expertise at the table, it's really important for PE teachers to know about school-based health centers and for everyone to know in the school to know about what everyone else is doing so that they can work together to support the children in the school. And so ensuring that nursing is at the table for all of these conversations and so that it is a collaborative approach. So.
Awesome. And Katrina, last but not least.
Yeah, I'll also emphasize that same point, this idea that, the school nurses are part of the greater school staff in the building and that they should be invited to the table when we're talking about, when teachers are talking about individual challenges with students, a lot of them come back to things that they're experiencing in their health. And so having school nurses at the table for those IEP meetings, for those behavioral assessments, really are important to kind of creating successful plans for students in the building. And that it being connected to who's teaching, the health class, who is providing the PE, who are the, who is the creating the meals for that school building. I think are important to create these connections across this leaders in the building is important for school nurses.
Awesome. This was a wonderful panel discussion. Kathleen, thank you so much for your practice reflection. And we are now going to take a quick 5-minute break. Thank you all. And we look forward to you joining us after this 5-minute break. So that means let's go for, I don't think we're going to do 15 minutes. So let's go for 12:38 p.m. Eastern time. Thank you.